Good evening, I'm Deborah Pinkerton. February is American Heart Month. Tonight, Penn State Health heart and vascular specialists will share why it's so important to keep your heart healthy. And here's why. Heart disease is the leading cause of death in the United States. Studies show someone has a heart attack every 40 seconds. About 1 in 20 adults aged 20 and older have coronary artery disease. Doctors will answer some important questions like what are the best ways to keep your heart healthy? How does heart disease differ between women and men? And what are the latest treatment options to lower high blood pressure? And if you have questions at home, Janelle Knight is here to tell you how to get them answered. Hi, Janelle.
Thanks, Deborah. Dr. Priya Rajgopalan, interventional cardiologist at Penn State Health, is answering your questions in a live web chat until 8 o'clock. To submit a question, go to abc27.com/heart. I'll be back later in the show to share some of your questions. Back to you.
Thank you, Janelle. Joining me right now is Dr. Michael Farbaniak, Medical Director of the Cardiac Disease Prevention Unit at Penn State Health Heart and Vascular. When it comes to heart disease, let's talk about ways that we can keep our heart healthy.
Great, that's why I'm here. So the best thing we can start doing is start moving our bodies today. The American Heart Association recommends about 150 minutes of moderate intensity exercise a week or 75 minutes of vigorous intensity activity a week. After that, we have to make sure that we get our numbers checked, right? Blood pressure, blood glucose, blood cholesterol levels, know those and try to keep them within goal. If you're smoking, now is the time to stop. And then also manage things like stress and also work with your sleep habits too, as both those can impact your cardiovascular disease risk as well.
Let's also talk about diet because there are definitely things you should not be eating if you want to keep your heart healthy.
Absolutely. So when people ask me what diet they should have, I say a heart healthy diet is going to be full of fruits and vegetables, nuts, high fiber carbohydrates like whole grains, things like that. Look for lean proteins, healthy fats, avocado oil, olive oil, and fish. And try to avoid things like saturated fats, refined sugars, sweetened beverages, ultra-processed foods, and the like.
So when you mention nuts, I know that when I go to the grocery store, they have those lightly salted nuts, and then they have ones that seem like they have a lot of sugar on them. So avoid those.
There are some nuts that are kind of like candy. So avoid honey roasted and high sugar kind of candied pecans and stuff like that. Also watch out for hidden salts. So not just in nuts that are salted, but also things like hot dogs and bacon can have a lot of salt for a little bit of food.
Yeah, certainly good advice. Now, we hear a lot about this cardiac calcium test. Why don't you talk about this?
Good. I'm glad this is becoming more mainstream. So the coronary calcium score is a CT scan that basically looks at your heart arteries and can measure the amount of calcium in them. Now, the calcium is going to be a representation of early atherosclerosis or early heart disease. And finding that out, looking at that information, may help us guide treatments and prevent premature heart disease and reduce your risk in the future.
Tell our viewers about this test and what's it like?
Sure, it's a very, very simple test, right? So maybe 30 minutes maximum. It's just a CT scan. It's non-contrast, so no IV, completely non-invasive. And again, then you get a report, and in that report, it's going to give you a number. And again, a 0 is what we're going for. A 0 is the lowest risk you could have from the coronary calcium score. And then the higher the number, the higher the risk, and the more aggressive we should be with cholesterol-lowering therapies.
Yeah, it is very simple. I had the test done, and it does take, I think, about 15 minutes total from setup. Yeah, so it was great. But, it's great that there are things like this because if you do have a higher score, there are things you can do about it.
Absolutely. So what we do, if you have a higher score, we look at your cholesterol numbers, right? And we can use that to kind of guide our treatments. So again, the mainstay of cholesterol treatments are going to be statin medications. But a lot of people can't tolerate statins. It has a number of side effects, and some people need more on top of statin medications. So there's some newer oral medications like ezetimibe and bempedoic acid, but even newer medications that are injectable. You can do injectables at home every 2 weeks, or there's even an injectable that we do in our clinics every 6 months that can lower your cholesterol by 50% or more.
Oh my goodness, so that is great news.
Yeah.
So who should take this test? Who would be the perfect patient?
All right, good question. So people between the age of 40 and 75, both men and women, that have an intermediate risk, so kind of in the middle risk of heart disease, or have a strong family history of heart disease should consider getting this test. Because again, this can really help us guide our therapies and preventative strategies at an earlier age. Also, if you're on the fence, if you should be started on medication for cholesterol or not, this one can help guide you toward either definitely taking a medication or perhaps maybe considering not taking medication as soon.
Yeah, that is certainly good news. Now, heart disease, it really differs for men, for women, for everyone. What are some of the symptoms that you should not ignore?
So the really high-risk symptoms, so the classic symptoms, of course, chest pressure, kind of in the center of your chest, happens with exertion, then gets better with rest. That's the classic symptom. But also, some people experience shortness of breath or unusual fatigue that's out of proportion to the activities that they're doing. This is also more common in women too. Shortness of breath will be more common in women without having chest discomfort, while men typically have that classic chest discomfort. Other signs and symptoms may include jaw pain, arm pain, nausea, vomiting, indigestion even. But again, if it happens with exertion, happens when you're moving your body and doing things, and gets better with rest, that makes it more likely to be related to heart disease.
Yep. And you should talk to your family physician, talk to your cardiologist.
Absolutely.
Call 911.
Don't wait on these things, right? The sooner we treat heart disease, the longer we can live and the better outcomes we have.
You mentioned cholesterol. Let's talk about cholesterol. I mean, you're
Absolutely.
hearing high numbers, low numbers. What's good, what's not?
Good. Well, we're going to keep it simple. It's too late for biochemistry. So low-density lipoprotein, or LDL, is your bad cholesterol. So this is cholesterol that in excess can cause plaque to build up in arteries all over the body. The high-density lipoproteins, or HDLs, are helped to clean out the arteries. This is our good cholesterol, so to speak. One helpful way to remember for our viewers at home too, so LDL starts with L, got to keep it low. HDL starts with H, got to keep it high.
Yeah, I love that. And you mentioned some of the different things that you can take, but there's always something new coming on the market.
Sure. Well, we did talk a little about some of the injectable medications, and that would be some of the newer things that we can do. So let's say, you're taking a statin therapy and need something more, or you can't tolerate statin therapies, then our clinic is perfect, right? This is what we specialize in. We'll look at you, we'll kind of give you a very individualized report on what your risk is, and then go from there and try to determine what medications, even some of the newer ones, that could be available. So I think the injectables are some newer medications out there, and what's cool about them is they can have different durations, either like every 2 weeks injection that you'll do at home, or like I said before, in our clinic, we can do it every 6-month injection that has some of the same impacts.
That's great news. So someone's watching and they're like, oh my goodness, I don't know how I can do this. What are just some simple steps you can do to keep your heart healthy, to get on that right track?
And this is an important question because it's overwhelming. All this information is being bombarded your way. People try to go through big restrictive diets. Take one small sustainable change. Something as simple as taking a walk at lunchtime for 10 minutes. So that's 10 minutes, 5 days a week at work. That's 50 minutes. That's 1/3 of what the American Heart Association is recommending. So you're already going to be 33% there. Make small dietary changes, like skipping soda on weekends or on evenings. These small, sustainable changes are going to be big impacts in the future. If you work with preventative cardiology, you have to play the long game.
Yeah. Small changes, big impact. Love that.
Absolutely.
Thanks so much for being with us.
Oh, it's my pleasure. Thank you for having me.
And for more information, or if you would like to make an appointment with Penn State Health Heart and Vascular, you can call this number, 717-828-3405, or scan the QR code on your screen. Now let's check in with Janelle Knight. Janelle, what are some of the questions being asked?
Thanks, Deborah. We have a wide range of questions coming into the web chat. Dr. Priya Rajgopalan, interventional cardiologist at Penn State Health, has been busy with us this evening. You've gotten a lot of questions already. Let's share some of them with our audience. I've heard heart disease can look different in women. What are the warning signs women are most likely to miss?
So traditionally, heart disease is considered to be a man's disease, with the misconception that it primarily affects men and leading to delayed diagnosis or underdiagnosis in women. Nevertheless, heart disease is the leading cause of death in women too. However, women tend to have non-specific or subtler symptoms like profound fatigue, feeling of shortness of breath, neck, jaw, or back pain, bad reflux, or just a general sense that something is not right. Many a times, as women, we kind of attribute to either anxiety, stress, menopause, or some minor illness and do not seek immediate medical attention, thus missing the warning signs of heart disease.
Interesting. Here goes another viewer question. I often get tired and short of breath, but I don't have chest pain. Could that still be heart related, a heart issue?
That's a very good question, Janelle. As we just discussed, that heart disease is the leading cause of death worldwide, and women tend to have subtler symptoms. And though chest pain is a common symptom of heart disease, people can have non-specific symptoms like a feeling of profound fatigue, shortness of breath. Some people just feel it as a bad reflux which never goes away. So whenever you have symptoms which persist or have changed in their nature, it is more than prudent to seek immediate medical attention so that we don't miss something serious.
All right, thank you so much, Dr. Raj Gopalan.
Welcome back. Joining me is Dr. Chad Zach, interventional cardiologist at Penn State Health Heart and Vascular. Hypertension or high blood pressure is so very common. Let's talk about what it is, how prevalent is it, and why is it such a big concern?
Yeah, of course. So hypertension or high blood pressure is when the force of blood against your arterial walls is too high. We define that as a blood pressure greater than 130 over 80, and we call it the silent killer because it occurs over years and patients may not have symptoms at all. But it's a huge risk factor for heart attack, stroke, heart failure, kidney failure, and even dementia. And it's so common. 30% of Americans above the age of 20 have some degree of hypertension.
Oh my goodness, and it can affect you really in so many different ways. So let's talk about how do you deal with high blood pressure. What about the treatments?
Yeah, I mean, the first thing we do for everybody is just like when Dr. Farbaniak was out here talking about lifestyle changes. So eating a healthy diet, reducing your sodium intake, less than 2,000 milligrams per day, and good old things. Exercising, quitting smoking, losing weight. Those are what we recommend for everybody. And for many people that helps, but there's certain patients where that's just not enough. Then, our viewers may be familiar with some of these medications. We consider ACE inhibitors like lisinopril, beta blockers like metoprolol, labetalol, or even thiazide diuretics like hydrochlorothiazide. These help to dilate the blood vessels and help to reduce fluid retention. And that can be effective for many patients as well. But medications can have side effects as well, making them difficult to take. Some people may get lightheaded, dizzy, or have headaches. Or even just like I have patients that are on 3, 4, 5 blood pressure medications, and we know that the more medications you take, the harder it is to remember and it is to be compliant with them.
Yes, it can be difficult when you're taking a number of medications. Let's talk about this newer treatment option that's available and how this really relates to your kidneys.
Yeah, so Deborah, there's a new procedure called renal denervation. It's been FDA approved for a couple years now, and we have a program up and running at Penn State Health. It's funny, I teach the first-year medical students in their problem-based learning sessions throughout most of the year. And we do this by organ systems, but almost every block we're always talking about the kidneys. The kidneys are important for water and salt retention and regulation, and it also releases hormones that can affect blood pressure. In addition, our kidneys have blood vessels that supply the kidneys with blood that it uses to filter. Those vessels are wrapped with nerves, and those nerves secrete hormones like adrenaline, noradrenaline. And these type of hormones can rev up the nervous system. It's like stepping on an accelerator that can cause blood pressure to rise because blood vessels are being clamped down. Renal denervation acts to put the brakes on this and help improve blood pressure control.
Let's talk about the procedure. How does it work?
Yeah, this is a minimally invasive procedure. So we bring patients in. If any of the viewers are familiar with a heart catheterization, it's very similar. We go through the groin artery with a catheter. We take pictures of the kidney arteries. We make sure that they're healthy, that there's no problems with them. And then we introduce a specialized catheter that uses radiofrequency ablation to take care of or treat the nerves that surround the kidney artery, reducing those levels of adrenaline and helping to get that under control. It can be a very effective procedure for some patients. For a quarter to a third of patients with uncontrolled blood pressure, we can see massive drops. But at the very least, most patients are going to get a drop of blood pressure of 10 millimeters of mercury. That's where the top number decreases by 10. That's as effective as a blood pressure pill that you would take every day, but you don't have to take a pill at all.
Yeah, that's great.
And it's important because we know that if you drop that top number by 10, you cut your risk of cardiovascular events and stroke by 20%. So it's super important.
So who is a good candidate for this procedure?
Yeah, so the vast majority of our patients, believe it or not, we have patients on 3, 4, 5 blood pressure medications, and they may be doing their best, taking them every day, and their blood pressure is still 180, 190. They're ideal candidates for this procedure. The other thing is that, everybody's different, and we all have different sensitivities, different tolerances. And so there are patients who may have been tried on 5 or 6 medications, and they can't tolerate it due to side effects. Those patients still need their blood pressure controlled. They still need their risk mitigated, and renal denervation may be an option to treat their blood pressure without having to take medications that it's difficult for them to tolerate.
So our viewers who are frustrated with, say, the medications they're taking, what should they do?
Yeah, there's hope and there's options. Even if it's if medications aren't working effectively or you're having a difficult time taking them, at Penn State Health and on our Hershey campus, we have an entire clinic devoted to hypertension. We work in collaboration with our colleagues in nephrology, and I'm personally happy to see anybody that's willing, that wants a second opinion or is interested in this blood pressure procedure, renal denervation.
Yeah, that's wonderful. Dr. Zach, thank you so much for telling us about this and sharing this with us this evening.
Awesome. Thank you for having me.
If you would like more information or if you would like to make an appointment with Penn State Health Heart and Vascular, you can call this number 717-828-3405 or scan the QR code on your screen. Let's check in with Janelle right now and get more answers to our web chat questions. Janelle.
Thanks, Deborah. Back with us is Dr. Priya Rajgopalan, interventional cardiologist at Penn State Health. This viewer wants to know, if heart disease runs in my family, what tests should I ask my doctor about to catch problems early?
So heart disease describes a lot of conditions which can affect the heart, common being those affecting the blood vessels of the heart or coronary artery disease. There could also be problems with heart rhythm. There could be problems with the structure of the heart or the function of the heart. So if you have a family history of heart disease, the first thing I would recommend is to map out what runs in the family, including having an exact diagnosis and the age when it has occurred in your family member. Having a discussion with your physician would help define what the next steps should be. They should also include regular screening for conditions like high blood pressure, diabetes, and maintaining healthy cholesterol levels. One can consider referral to a cardiologist depending upon the heart disease, and basic cardiac testing, including an ECG, where we look at the rhythm of the heart, and an echocardiogram to obtain an ultrasound of the heart to look at the heart's function, could be the initial steps. We do have a lot of special tests to diagnose certain heart disease earlier and improve outcomes, including obtaining a coronary calcium score. This is a way of looking at calcium buildup in your heart arteries, which could be a precursor for development of heart disease. Special kind of imaging, including MRI of the heart and CAT scans of the heart. Special cholesterol testing, like testing lipoprotein levels, or even genetic testing. So we do have a wide variety of tests, which depending upon what kind of heart disease runs in the family, you can discuss it with your cardiologist and can be considered so that we can improve outcomes in patients with family history of heart disease.
All right, thank you so much, doctor.
And thank you, Janelle. Joining me right now is Dr. Behzad Soleimani, Chair of the Department of Surgery and Director of the Penn State Health Heart and Vascular Institute. Thanks for being with us.
Thank you for having me.
So Penn State Health Heart and Vascular Institute has achieved a 100% 3-year survival rate for heart transplant patients. That is wonderful news, placing the program among the best in the nation. What does that kind of recognition mean to you and your team?
Well, it means the world to our team. The best in nation 100% 3-year survival is all the more impressive when you consider the complexity of the patients that we see in our program. And statistically, many of our patients are not expected to live as long as they do. And the only reason they do that is because of the commitment and the talent of our multidisciplinary team that give their hearts and souls to this program and do everything they can to serve the patients that they put front and center. And the results really speak to that dedication. I'm very proud of the team, and I'm honored to be a part of that team.
And results like this don't just happen by chance. What makes this heart transplant team so strong, and how does working together across so many different specialties really make a difference?
Yeah, heart transplant, I would say, is the ultimate team sport. And when teams function cohesively and communicate clearly and put patients at the center of everything they do, amazing things happen. And our team does exactly that. And the team does that in the entire journey of the patients through the transplant process, from heart failure at its onset to advanced heart failure, transplant, and post-transplant. And having that degree of dedication throughout the journey is what delivers the results that we see today.
And you really do treat the entire person. You help them emotionally as well as medically before and after the transplant. As you mentioned, it is a journey.
Yeah, it is a medical journey for sure, but it's also an emotional and psychological journey. And our team recognizes that. And we make sure that the patients are supported, never feel alone, their families are supported. And by doing this throughout the entire journey, what we find that patients that are emotionally and psychologically prepared and strong heal faster. They do better after heart transplantation. And this is one of many factors that come into the ultimate outcome of our program and the excellence that delivers.
And there's some more information from this data. It also shows that every patient waiting for a heart transplant during this period survived. So why is that such an important measure of how well this program really cares for patients?
The heart transplant patients are often at their most vulnerable and sickest in the months coming up to a transplant, when they are on the waiting list for a transplant. And treating them with vigilance and diligence and looking out for complications early and managing them aggressively is the key to keeping them alive to transplant. And the fact that we can take every single patient that is on our waiting list to a transplant successfully, again, speaks to the excellence of the team and our overall holistic approach to these patients. But it's more than that. It means that patients that come to the operating room, they are in good shape, and that means they will do well after heart transplant, and that reflects in the long-term outcomes of the transplantation.
And many of these patients have built long relationships with your staff. How does that really make a difference as far as the healing process is concerned?
So heart transplantation is all about long-term partnership and relationship, and partnership and relationship are important because they generate trust between the care team and the patients and the families. And when the patients trust us, they feel comfortable calling us when something doesn't feel right. And that allows us to intervene in a timely fashion and put them back on correct course. And that reflects again in how well they do after the transplant.
And why do you do this?
I myself, and I'm sure I'm speaking for all my colleagues in the team, the joy of getting people back to their families and making families whole again is priceless. And especially every patient is special, especially younger patients that have their whole lives ahead of them, young families, getting them back together and seeing them thrive and live long, meaningful lives is the best thing we can see. And that's why we turn up every day to do this.
That's wonderful. Thank you so much for being here with us and sharing this with us tonight.
Thank you.
And we send a special thanks to you, our viewers, for sending in your questions. If you would like more information or if you would like to make an appointment with Penn State Health Heart and Vascular, call 717-828-3405 or scan the QR code on your screen. At Penn State Health, caring for hearts goes beyond the hospital walls. Every day, the cardiovascular team helps patients overcome disease and build healthier lives. Each February, the Give from the Heart campaign brings that care directly into our communities. Funds raised supports programs like community health pantries and the PAWS program, both providing heart screenings and health assessments for neighbors who really need it most, right here where they live. If you would like to give from your heart today, you can scan the QR code on your screen. Tonight, specialists from Penn State Health Heart and Vascular have done an excellent job explaining why it is so very important to keep your heart healthy. It will make a difference. We want to thank you for watching tonight, and we wish you good health.